Every year in Canada, thousands of patients die while waiting for various healthcare services. In fact, government data obtained by our think tank secondstreet.org found that since 2018, over 100,000 Canadians have died. And that's actually an incomplete number because many governments either don't track all of the data or it's simply incomplete. So we got a big problem here, and we've been digging into this issue because of stories like Laura Hillier's. She was a young 19-year-old Ontarian who died. Her call for help went viral many years ago, and it drew attention to this problem of patients dying on waiting lists. We're looking into this issue because of stories like Jerry Dunham, an Ontario patient who during COVID was forced to wait too long for a pacemaker to be installed, and he passed away, leaving behind two young children. In Manitoba, more recently, Debbie Fuster, a mother and grandmother, died while waiting for a heart surgery. So we've got this problem in Canada. We've been trying to dig into it, but this is, of course, is not the only problem related to healthcare. We've got thousands and thousands of patients suffering on long waiting lists and facing other problems while they wait. So today we're going to dig into this issue and talk about some solutions. I've got two great guests lined up to talk about this. Rosalie Wyonch is the Associate Director of Research at the C.D. Howe Institute, and Renaud Brossard is the Vice President of Communications at the Montreal Economic Institute. Thank you both for joining me today. I'll pose a big picture question to both of you to kick things off, and that is, do you think that we're actually in a healthcare crisis right now in this country? And Rosalie, I'll ask that question to you first.
Well, that's an interesting question. It's in healthcare, the sky is always falling, but never quite falls. So I'd say there certainly is a crisis, but it's one that has been slowly developing due to a whole bunch of systemic conditions over a long, long time. And I think really the system started showing its cracks during the pandemic, and now we're just still seeing what we maybe weren't paying attention to before, but as the population grows, I think the access challenge is getting worse.
Okay, Renaud, same question to you. Do you think that we're facing a healthcare crisis in Canada right now?
I think the answer is a clear and emphatic yes. But as Rosalie alluded to, we've been facing that same healthcare crisis for the better part of the last 40 years. It's only been slowly getting worse. I think it's no secret to Canadians when we when we decided as a country to go with a universal, publicly accessible healthcare system. The publicly run part of our health system was actually brought forward. You know, there's no all the hospitals are government run. There's very limited access to private independent healthcare, but the universally accessible part of it was never fully fulfilled. I think that's what Canadians see whenever they whenever they have to interact with the health system, whether they're waiting to get a family doctor. We still have millions of Canadians that don't have a regular family practitioner or nurse practitioner that they can go to, or whenever they need to get surgery for one thing or another, as you alluded to. Unfortunately, a lot of people wait too long and are not able to get the treatment they need in a timely manner. And their conditions can get worse up to, and unfortunately in some cases, death. And then, of course, there's a matter of emergency room wait times. When people need emergency care, they now need it 4, 5, 6 hours from now. But unfortunately, that's the reality in way too many places in this country. One of the things that we looked at the MEI was how long patients typically have to spend between the time that they enter an ER to the time where they leave the ER, either to be admitted into the hospital or to go back home. And in all provinces, that has grown significantly over the last 5 years. In some cases, in the province of Quebec, where I'm from, patients typically have to spend 5 hours and 23 minutes to get treatment. Now, of course, that'll vary by hospitals. But when you think about it, the nature of an emergency is something where you need healthcare fast. You need healthcare treatment now. And when you have to wait 5 hours and 23 minutes to get that treatment, that just doesn't well, it's not what emergency patients need. They actually need that treatment now. So of course our system is in a crisis, but it has been slowly getting worse for the past 40 years. And I can't think of a time in my 33 years of lifetime where we haven't been in a healthcare crisis.
Yeah. Certainly does feel like we've got a crisis right across the country. When we come back, we're going to talk about solutions. We'll be back in just a moment.